We're talking about arousal, aggression, and dysregulation. This comment asks, do puppies grow out of this naturally? Our boy pup is around 6 months and just started doing this. He's humping and lunging and biting. He's so sweet and then out of nowhere gets snappy. So the short answer is no. Dogs do not grow out of this behavior. But there is a longer answer, so let's talk about it. So first, let's define what we're talking about: arousal, aggression, and dysregulation. When I talk about arousal, I'm talking about typically dogs who are experiencing high levels of stress hormones. On our stress scale, we're talking about a dog usually in like the orange or the red when we're talking about high levels of arousal that are problematic, that can lead to aggressive behavior. The emotion underlying that arousal can vary. It can be anxiety, it can be fear, it can be frustration. But even if when the dog was lower on the stress scale, this all started from a positive emotion, by the time they're up there in that orange or red space, they're no longer having fun. Their sympathetic nervous system, fight or flight, is more activated than their parasympathetic nervous system, rest and digest. So they're gearing up, their body is gearing up for a survival response, perhaps of fight. Aggression is the fight response. Aggression is a bid for space. And that can be confusing to us for a myriad of reasons. But suffice it to say, aggression is a request for more space for one's body. Even if the dog approaches first, that means that they needed more space than there initially was, and their brain doesn't perceive the option to move away, so they are going towards aggression to try to gain that additional space. And then we have dysregulation. So nervous system dysregulation typically refers to dogs who are spending more time in that sympathetic nervous system or whose stress hormones are chronically higher than ideal. They tend to struggle with resilience to stress, and they often struggle with the ability to self-regulate. So you could have a dog experiencing high arousal who is not aggressing and who is not chronically dysregulated. You could have a dog who is displaying aggressive behavior, but is not chronically dysregulated. And you could have a dog with chronic nervous system dysregulation who is not necessarily displaying aggressive behavior. Now, back to the commenter's original question about this puppy that has just turned 6 months and then seemingly out of nowhere is humping and lunging and biting and snapping. So around 6 months is where most dogs enter adolescence. So if we're thinking about our stress scale and we're thinking about how the green zone is thinking brain and the red zone is more survival emotional brain, in adolescence, the amygdala, which is housed in the limbic system, figuratively explodes. And the thinking brain, the prefrontal cortex, literally shrinks temporarily. It's coming back, but it does temporarily shrink. Stress hormones increase just because we're in adolescence. We see sleep disturbances, we see restlessness, we see bigger emotional outbursts. This is where, if we have had some underlying anxiety or some underlying fear, this is where we might start to notice it behaviorally. It might become more salient to us during this time. And there are a few factors that influence when adolescence starts and when it ends. Female dogs tend to have a longer adolescent period. Dogs who are spayed or neutered before adolescence is over have a longer adolescent period. Larger dogs mean longer adolescent period. But for a lot of dogs, it starts around 6 months, it ends around 2 years. During that time, our dogs are especially vulnerable to the influence and impact of toxic stress levels, just like you see with children. So if we are just seeing normal puppy arousal, those higher stress hormones, that impulsivity, those big emotional swings, and it's because of adolescence, the trick is to manage. So you need to make sure that those behaviors aren't being rehearsed, they aren't being practiced. Otherwise, they're not just going to stop one day when the dog comes out of adolescence, because they're going to be strongly part of the behavioral repertoire. So a lot of adolescence is managing unwanted behaviors, preventing their rehearsal, focusing on keeping stress levels lower. So for example, doing a lot of calming enrichment, that sort of thing, making sure that needs are appropriately satiated versus like exhausting our dogs, which is really common when we think, oh, they need to get more energy out, but really making sure that they're getting enough sleep. Our adolescent dogs need between 18 and 20 hours of sleep a day, just like puppies and senior dogs do. And so it's a lot of that. It's a lot of focusing on management and enrichment. And then when their brain is back online and their stress levels are lower and they haven't had a year and a half or so of practicing these unwanted behaviors, they can often better handle those situations. That is not going to be the case for a dog who is dysregulated. If you have a dog who has a dysregulated nervous system, they are living in a yellow zone, living in an orange zone, frequently flying up to the red zone. Those dogs have anxiety disorders. They might have hyperarousal or hypoarousal. You might see trauma, or they're experiencing chronic stress because their environment is so stressful, often because they have so many triggers that it's difficult to manage. Those dogs certainly might have a harder time during adolescence, but they need management as well. The management is vital. The enrichment piece also appropriately satiated. All those things apply, but they also need behavior therapy and often behavior medication. And remember, anytime we're concerned about, but will behavior medication, alter my developing dog's brain? Usually, if we're asking that question, we want to alter the development of the dog's brain and their nervous system because it's not developing in a way that's healthy or safe. And then aggression. Dogs do not outgrow aggressive behavior. Aggression is a natural, normal response. What becomes a problem is when we are seeing aggression used in situations where we're like, this is not sustainable, this is not safe. And so we want to reduce the need for the dog to behave aggressively. We want to let them know that we can hear them when they're speaking more quietly. We want to avoid putting them in situations where they need to ask for more space so loudly. We want to manage their arousal levels so that they can ask more quietly. And we may want to increase resilience and the ability to self-regulate depending on the individual dog, certainly if they are dysregulated. Anytime we're seeing aggression too, we also want to do a vet check. Really, if we're seeing dysregulation as well, up to 80% of cases involving aggression also involve an underlying health component. Dogs who don't feel well in their body are more likely to aggress. Generally, these behaviors, so humping, lunging, biting, and snapping, those are happening significantly higher on the stress scale, orange and red. And that typically does not come out of nowhere. There are some cases where dogs can shoot from what seems like a more green state up the scale, but those dogs generally are not existing in a true green state. Those dogs are often dysregulated. Or it could be happening, if you have a dog who has, like, say, a very strong startle response or something like that. They really struggle with sudden environmental change. But again, those dogs that are shooting all the way up there when they are surprised or startled or the environment shifts usually are dysregulated. They have an anxiety disorder, or they are hyper-aroused, or they have some trauma. The trick is to be able to notice the signs, and they can be really inobvious. It is super normal for us to really notice the behaviors that are salient to us, especially if they're aversive to us, right? Like, it's pretty hard to ignore biting, lunging, and humping. It might be less easy for us to track and see, some avoidance behaviors, like leaving the room or turning the head away or yawning. Or it might be trickier for us to notice that the puppy has gotten a little bit more fidgety, or that their fine motor skills are starting to go offline, or that they're engaging in displacement behaviors like sniffing or licking or chewing extra hard on the toy, carrying the toy around in their mouth. We might not flag those as problems, but they could be signs that stress levels are continuing to elevate. A really common thing that I see in adolescents is puppies who are not getting enough sleep, and so they are exhausted. And it's this terrible snowball effect because they're not getting enough sleep, and so they're toddler tired, which to us looks like they need more exercise. So then we take these exhausted puppies and we give them more exercise, and then they're super exhausted, and then certainly we can see meltdowns. So that's on arousal, aggression, and dysregulation. Remember, they can happen independently, they can happen together, but dogs do not grow out of these concerns, with the exception of, I suppose you could call it growing out of, if it's normal adolescent behavior, but it has to be well managed. If it just continues to be practiced, it will not just go away when they get older.